Okay. Shanae, you want me to take over now?
Sure.
Okay. Good morning, all. Welcome again to our CCT monthly meeting. Can't believe it's the end of August. So we'll begin by writing your name and organization in the chat. And if you want to come off mute, we'll be having an icebreaker soon. So you'll be able to come off mute and speak. Okay. Next slide. And so this is the agenda. We're going to do welcome and introductions. I will also introduce our new coalition manager, Shanae. Then we'll have a discussion defining community. So I think this will be a rich discussion today. So looking forward to all your participation and feedback. And then we will end with community announcement and then adjourn the meeting for today. Next slide. Okay, so it brings me great pleasure to introduce our new coalition manager, Shanae Vicks. Shanae is a passionate health educator and public health professional dedicated to advancing health equity and health literacy. She's originally from Southern New Jersey. She moved to Maryland to earn a bachelor's degree in psychology from Morgan State University. She later earned her Master of Science degree in public health from Johns Hopkins Bloomberg School of Public Health with a concentration in health education and communication. She also has a certification in maternal and child health. In recent years, Shanae has deepened her focus on community health, health equity, and health literacy, working to ensure that populations facing systemic barriers have equitable access to education, services, and resources. Through active collaboration with community organizations, leaders, and members, Shanae Works reflects the commitment to culturally responsive, community informed approaches that prioritize those disproportionately impacted by health disparities. All help me welcome Shanae Vicks.
Thank you. Thank you. I really appreciate that so much. It's definitely a pleasure being here with you all and finally being, I think this is the last work group that I have had the pleasure of joining. So I finally did everybody. But it's nice to see some familiar faces and to put faces to names. And I'm definitely looking forward to today's discussion. So thank you so much, Tarnisha, for the warm welcome.
Yes, welcome. We're glad to have you.
So I guess with that, since I was introduced, I think this would be a great time for me to get to know you all a little bit. So I'd appreciate it if you all could go around the squares. I know we're not in a room, but if you could go around the squares and in 2 minutes or less, share with me your name, your organization, the services you provide, and some of the populations that you serve. So think of this as your elevator pitch, right? We're walking into an elevator, we're going up to whatever floor you work on, and we've got 2 minutes to do a quick chat of who are you and what do you do. All right, so I don't know if anybody kind of just wants to get started. Feel free to jump on in.
Good morning, everybody. Hi, my name is Denise Robinson. I'm the executive assistant here at Community Engagement and Consulting Group, known as CECG. Um, we're in Beltsville, Maryland, which is in Montgomery County, and we provide wraparound services for SNAP, Medicaid, health, other resources that we have here. I
Great,
think we'd be sharing. Yeah, I think we'd be sharing that because we'd be speaking next for the other services that we provide.
thank you. Next.
I can go next. My name is Crystal. I'm a special needs coordinator for WellPoint, which is one of the Medicaid MCOs. I attend this meeting really just to kind of gather resources and information for our members, just so that way we can connect them to all that you all have to offer within the county.
Great. Nice to meet you. Thank you.
Yep, thank you. You as well.
Hi, good morning. Good morning. Good morning. My name is Shatia Blunt. I am the CEO of IME LLC, which is a a mental health social enterprise dedicated to elevating Black minds through mental health. And in that, we provide direct services to folks in DC, Maryland, Virginia. And also, I have an incubator practice where I help psychotherapists to launch their private practices. And I'm in the education space and a little bit in the advocacy space as well. So nice to see you all, and thank you.
Nice to meet you.
Thank you.
Hi, I'm Cynthia Fields. I am a chronic disease and prevention program coordinator with Totally Linking Care in Maryland. We provide services in Maryland and in DC. We are a DPP hub and also a community care hub. So our focus with the community care hub is meeting the social, the needs of the patients and connecting them with care and addressing those needs that come through the social determinants of health surveys.
Thank you. Nice to meet you.
You too.
Hi,
Hello.
everybody. Oh, sorry, go ahead.
You go ahead. I'll go next.
Okay. I'm Caitlin Murphy Ladelma. I am the Associate Director of Health and Wellness Division in the Prince George's County Health Department. And let's see, my agency is the health department. The services provided, well, we do a lot of stuff, but in my division, our division specifically, we do kind of care coordination, chronic disease prevention and management. We transport folks who receive Medicaid to their medical appointments, and we do some senior care to make sure people can age in place effectively. And yeah, we kind of serve everyone. We I would say the only folks historically we maybe didn't serve as much were were children, but we're about to launch a program for childhood obesity treatment next month. So we kind of cover the whole lifespan. Thank
Love
you.
it. Thank you.
Hello, my name is Tanya Mahan. I am a community health worker that works with MedStar Medical Group. We're in 5 counties, Charles, PG, Calvert, St. Mary's, and Anne Arundel. I work with population health mostly, but of course, since we're covering all 5 of those counties, it spills over into our commercial insurances and Medicaid as well. And I'm just trying to connect with more resources and community-based organizations in the community, just so I can bring that back to the practices, because traditionally our providers just tried to handle it in the immediate community or in office. As we well know, social needs and behavioral health and things are, the need for that are growing. So I'm just trying to, be more versed so I can help the practice and help the patients.
I love it. Thank you. Nice to meet you.
You too.
I'll go next.
Good morning.
I am the program manager for our community health department at Northwest Southern Maryland Hospital Center. So we oversee the outreach for the hospital, as well as our community health workers. And what we do is everyone who comes to the hospital gets screened for social determinants of health. If they screen positive for anything, they get forwarded to our community health workers, and then they connect them with resources. We follow them for up to 45 days and just connect them with resources, whatever that may be. Provide referrals to our partner organizations. It's not something we can provide in-house. And then I also coordinate all of the outreach efforts for the hospital.
Nice. Thank you. Nice to meet you.
Good morning. I'm Sharon Zalewski, and I'm the Executive Director of the Regional Primary Care Coalition. And we're a coalition that works with our local funders, primary care associations, and nonprofit healthcare providers in Prince, and it's throughout Northern Virginia, DC, and suburban Maryland. In Prince George's County, I primarily work with the federally qualified health centers and the health department on various projects. But I come to these meetings because I find it valuable to hear what people on the ground have to say about resources that are available, and also about gaps in services. if we don't speak about the gaps, we can't fill them.
It's true.
Yeah, thank you.
Thank you. Nice to put a face to the name. I hear your name often. Any others?
I can go next. Hi, I'm Tawny Shistos, the program chief for the Chronic Disease Prevention and Health Promotion Unit within the Health and Wellness Division at the Health Department. No, that was a mouthful, but we do a lot. Our target population is adults and children, as Caitlin mentioned. We're about to launch our childhood obesity program, the Family-Based Behavior Treatment Program. So we're really excited about that. We also have diabetes prevention programs because we are Umbrella Hub. We also get patients connected to DSMES for patients that has type 2 diabetes. And also, we're always seeking grant funding to bring back our hypertension medication therapy management program. So we focus a lot on chronic disease and getting patients connected to those evidence-based programs and also making sure their social determinants of health needs are addressed as well.
Thank you.
Mhm.
Yeah, hi,
And I
I
can
can go
go.
next. Oh,
You go
sorry.
ahead.
Oh, thank you. I'm Tatua Sperry, and I'm a program associate at the Institute for Public Health Innovation, or IPHI. We're the regional public health institute for DC, Maryland, and Virginia. I was invited to join these meetings by a colleague of mine, Christine Stewart. Mostly, I think within this space is we provide capacity and workforce development. So we have an accredited CHW training, accredited by Maryland Department of Health. So we help to train and deploy community health workers for health departments, nonprofits, other partners. As well as we work on policy systems and environmental changes. So we also are policy advocates as well. And then I'm personally a CHW trainer and work with the community health worker population. So I'm so excited to be here today and to meet you all.
Thank you for joining us. I remember one of your trainings. I think I've sat in 2 of your trainings before for the CHW. So good to see you again. I think I heard another voice trying to pop in. Is there anyone else?
That was me trying to intrude. Good morning, everyone. It is my pleasure to reintroduce myself. So as many of you know, I have transitioned from my work with the Prince George's Health Action Coalition. I am now working with Tornisha and Caitlin and our team over in chronic disease prevention. I am the Umbrella Hub manager. So I manage our umbrella hub of all of our organizations who are out across the state providing diabetes prevention programs. So our goal with the program is to make sure that any Marylander has easy access to available diabetes prevention programs. Tornisha also described our self-management programs for those who are diagnosed with type 2 diabetes. So our population, we are constantly trying to expand it again to make sure that that access is provided to all of our populations across the state of Maryland. So if you know of any organizations in your local community who would like to become a diabetes program provider, please certainly get in touch with me. I would love to have a chat and see again how we can continue to expand our programs.
Thank you, Taylor.
Hey guys, I'll go ahead and give an introduction, be the last one. My name is Lisa Patillo, and I'm the Community Relations Specialist for Maryland Wellness. We're an outpatient mental health clinic located in Largo, but we're located all over Maryland, in Baltimore, Frederick, Oakland, Hartford, Charles County as well. We provide therapy, medication management, and PRP for anyone who's needing it throughout the lifespan, so ages 5 and up. And I attend these meetings because I find it very important to learn the gaps as well, and also see if there are any resources that I can pass off to our resources department. I know that there's a lot that's happening, a lot of changes in public health right now, and it's best for me to keep my ear down to the ground. So thank you guys so much. And yeah, I'm happy to be here.
Thank you. Nice to meet you. All right. I think given time, if there's anyone else that hasn't had an opportunity to share, please feel free to just drop your name and information in the chat box, and I'll be sure to keep an eye out and note that you're here. So thank you so much, everyone, for introducing yourselves. I know I'm like the newbie in the room, but it's really a pleasure to get to know each and every one of you a little bit better. And if any of you are interested in just kind of meeting on the side to share more about your organization, I'm more than happy to set up a 30-minute call with you and have that discussion. So thank you so much. I think we have a very interesting topic for today, and I'm excited to hear you all's perspective and insight on how we understand and can define the term community. But before we get started, I think it's really important to just provide a little bit of context to this conversation to kind of help ground the conversation a bit. So I would like to invite Taylor, the amazing Taylor Palmer, to provide us with some additional background. Taylor.
Alrighty. Well, again, good morning, everyone. Glad to see some new faces joining us on our CCCT meeting this morning. As Shanae mentioned, so much of our work is rooted in deep context that goes back to pre-pandemic times. So if this is your first CCCT meeting, take note that care coordination, it is certainly not a new topic. This has been around in Prince George's County. It has been a group that has been meeting to streamline care coordinating processes for many, many years now. And so we are rooted in a lot of context. We know a lot of the challenges that we have experienced around care coordination in Prince George's County, and that we continue to experience and continue to share within these work groups. So we wanted to bring about shifting our conversation today to talk a little bit about public health, building a more community-powered public health infrastructure. Today, you probably feel his missing presence. Our esteemed Dr. Ernest Carter is not able to join us. He is a co-chair with Tornisha Stokes. But Dr. Carter, he has been a champion in the care coordinating space for some time now. He was really a visionary for many years when it came to care coordinating services. And he's heard all of your feedback, and he's put together this community-powered public health infrastructure model. It's going to be one that he's going to be rolling out to the work group very soon. So I'm just going to give a very high-level overview of the model today, and then hopefully we can have a conversation about what does that foundation look like, and being able to include you all in the early planning stages of this community-powered public health infrastructure, because you all know it best. This is going to be a model that is built off of all of the expertise, the lived experience that you all have. And so we want to be sure to open up discussion today to start the planning process. So with that being said, I'm just going to present some historical challenges that have led to the inception of this public health infrastructure, and then I will end us with our call to action. That is the purpose of today's meeting. So to really ground us in the challenges that we've heard and we've experienced within this work group, we've heard, that despite decades of investment in public health, that preventable crises, they still persist. We still see staggering numbers in terms of chronic disease. You heard so many folks are in the room who are committed to chronic disease prevention and management, but we still see staggering numbers. We still see an ongoing mental health crisis. We see that, especially after the COVID-19 pandemic, we see these soaring numbers. And despite, pouring in money and funding into programs and practices, we still see that these challenges are still burdening our communities. So we take all of that on our shoulders to say, what is not working? What is not working in this traditional public health model of delivering services? There's also a gap in our infrastructure, and that our infrastructure doesn't give room for prioritizing people, trust, and communication. A lot of time we see a top-down approach. The public health innovation is coming from an organization and is placed on a community. Oftentimes the community is not at the center of that public health program or practice. Instead, it's being handed to them or delivered to them in a way that's not sustainable, that doesn't allow for community ownership, that does not allow for community customization, to know that the community knows themselves best, but they're not included in really that foundational stage of creating these interventions. There's also weak engagement with trusted community voices. Like I said, although we practice this a lot in public health, saying that we should center community voice. A lot of time, again, those innovations are still coming from top down. They're coming from an organization who may have received some grant funding, who is then placing an intervention on a community rather than really centering community voices and asking those trusted community voices to be a member at the planning table. The result of all of these challenges that I just presented include mistrust, widening disparities. We just completed a community health assessment here in Prince George's County, and we know that our disparities are really widening in terms of health outcomes and disease burden on our communities. And overall, this is producing poor readiness for future crises. We know from the COVID-19 pandemic that our systems were not in place to be able to respond as soon as we would have liked. We didn't have those community models that were in place already up and running. We had to really work on the ground in real time to develop these models. And so it's not setting us up to be able to proactively respond to crises. And so with all of that being said, Shanae, if you could advance twice. So that leads us to where we're at now. What we've heard, again, echoed from our community care coordination team. We've taken all of your feedback, asking you all, boots on the ground, what are you experiencing within your organizations? At these monthly meetings, we've had care coordinators who have come in and presented their care coordinating services. We've heard from the Department of Social Services. We've heard from our mobile response team, and everyone is saying the same thing. They're experiencing the same challenges that has to do in care coordination, that overall, we're looking at it in terms of one challenge to the social determinants of health. And again, these are all interventions that are really placed on our community. And so with that being said, a few takeaways that the planning team, that the CCCT planning team has really taken away from the work group is that a limitation is really the community-centered leadership. So we're not utilizing those local influencers. We don't have that buy-in here in Prince George's County to really make sure that interventions and programs and initiatives are successful. There's also a lacking body of two-way communication. So, again, we're providing services, but we don't have those bidirectional feedback loops to hear from the community what is going well, what may not be going so well. And so that's presented a challenge, especially when trying to refine care coordinating services and trying to make sure that we are effective as possible with our resources. And then again, a lacking sustainable local infrastructure. We are, we were super engaging during the COVID-19, but we're seeing some of that engagement slowly pull back. And so we need to reintegrate ourselves back with community, recenter ourselves with the community, hear from community directly to hear what are their challenges, what are they experiencing, what is important to them, and what are the solutions that they would like to see. And so that leads us to where we are at here and now and planning for the future. So I wanted to be sure to put this in green so we leave off on a positive note, so we know that positive change is happening. So where are we going with the CCCT? Again, like I said, we've taken the months to center all of the voices in this room to hear what are the challenges around community care coordination. We've heard you all. We know the challenges that presented during the COVID-19 pandemic, and this is how we are preparing to respond. And that's with building community-powered infrastructure. This infrastructure is more than just the words that you see on the screen. It is a truly community integrated practice. It seeks to bridge those top-down strategies with grassroots engagement. So it includes letting the community identify how they see community, then working with that self-identified community for those folks to be the change agents in the community, to address the health issues that they see as most prevalent, that they see as most pressing to their community. It's not us saying, we recognize that this zip code has a high level of diabetes, and then giving an intervention. It's instead starting with the community from day one to allow those folks to identify their issue area and then to be able to mobilize their assets, to not just look at it through a deficit lens, but to allow the community to identify their assets they have in place, and then to also train those folks to be the mobilizers and the caregivers of their own health, to improve their own health for greater sustainability. And again, this model really emphasizes that efforts are people-centered, data-informed, and community-led. This project is embedded in trusted local spaces, so it's different from that traditional model where an organization is the holder of that intervention and it gives the intervention to community, because this intervention is truly ingrained in the community. It prioritizes those community voices, the community leaders, to really be the thought leaders behind delivering this intervention, with technical assistance from everyone in the room, from our lived experience as care coordinators, but again, really emphasizing the need for community voices to be centered and to be at really at the forefront of delivering culturally resonant education and services. So this is a super high level overview. But again, we wanted to be able to ground today's discussion in what is the CCCT thinking. Again, we've had these conversations about our gaps and our limitations to care coordinating services, and this is what we wanted to respond with, really building out this community-powered public health infrastructure, a new way of thinking about public health and population health investment and improvement. And I will let Dr. Carter speak when he returns in a few weeks. He will be able to share more with the CCCT about different aspects of this model. But to start us off, what we need from you all today is we want to open the floor to a conversation about community. Because this model is so ingrained in the community, we really need to go to our public health basics, and we really need to define what is community. And we thought, what is the best way to define community than to hear from you all? So we want to hear from you all today about the communities that you serve, that your organization serves. How did you all begin to think about what community looks like? How did you identify the community that you are going to prioritize with services? What are our gaps? What does community look like in care coordinating services? So we have some facilitated questions for you. I will let Shanae and Tornisha take back over and facilitate our discussion, but if you all have any questions about that public health infrastructure, feel free to include it in the chat, but this will again be an ongoing discussion that we continue to have as the CCCT.
Great, thank you, Taylor. Tornisha?
Yes. Okay. So I'm sure throughout the presentation and the conversation so far, just listening to why people are here, what agencies they represent, you heard gaps in services, resources, care coordination, infrastructure, community, trust. So today we have several questions because, again, we want to hear from you to help build this public health infrastructure and making sure we understand what you understand as community. So we're going to start with the first question, and please provide your input. This is an open discussion to help us build this infrastructure that you'll hear more from Dr. Carter and as you heard from Teller this morning. So the first question, who are the trusted networks and local champions in the community you serve, such as churches, barbershops, sports teams, even social media groups? So anyone like to take a stab at the first question? And I can start then. So for an example, I'm going to go back to Prevention Link, which is near and dear to my heart. So as part of Prevention Link, our trusted network include like the residents. We do a lot of outreach events to talk about the different services that we have to offer. And once you gain that trust, because they'll begin to talk to you to tell you about maybe some of their medical history, or their children or their parents' medical history. We have great relationships with providers throughout Prince George's County. We have a provider network where we have private practices and a few federal qualified health centers that's part of our network work that actually send referrals for their patients to the the various programs that we have to offer. We also have relationship with some of the churches as well, where we go and do outreach events and also promote our programs and get their um, members enrolled into various evidence-based programs that we offer. We also have a close relationship with Channel 9 News. We do a lot of advertisement and commercials on Channel 9 News in the past. Dr. Carter was on the radio station. Dr. Levy was on Channel 9 News as well. And hopefully very soon you'll see more information regarding our childhood obesity program. So that's just some of the examples based on the work we're doing around Prevention Link. So would anyone else like to share? Okay, I'm gonna pick and call on someone. Shanika, would you like to share some of you feel that your trusted network working with the transportation, the non-emergency transportation program, as well as ACCU?
Good morning. I'm sorry I missed the introduction. I was offline at a meeting. My name is Shanika Cooper, and I also work at Prince George's County Health Department, overseeing the non-emergency medical assistance transportation program and the administrative care coordination unit, which is a Medicaid education care coordination program within the health department. So we have many trusted partners and probably share a lot of the partners with Prevention Link. So for transportation, it would be our area vendors, the hospitals, the federally qualified health centers, the nursing homes, and any medical facility or provider within the county. ACCU would probably be the same, and including the managed care organizations and MDH. Thank you for asking.
Thank you.
Hi, I'd like to share.
Okay.
So I'm really pondering the question, and I'm asking myself, well, how are we defining community, right? And then as I just think more deeply, I think about the folks that I encounter daily. And I think that I'm a part of the trusted network of many of the communities that I serve, right, as a practitioner. And so that makes me know and understand that other practitioners are part of the trusted networks for the communities. A referral from me to an organization would be much stronger than just like a commercial or, you know what I mean, or something like that. And then also thinking about a lot of the work that I have to undo in the work that I do as a practitioner. And so this brings me to the conversation around social media and influencers. And public speakers that oftentimes, you know, have a message or have a message or a way that they're trying to influence folks, whether it is for what is for the greater good as it relates to health or not. The truth is that they have a lot of power and become trusted people, you know, for anybody who's engaging with, you know, TikTok or Instagram or now Threads, etc. So I would say that, you know, while I won't be able to identify specific people, really because I have my opinions, I do know that they are in fact trusted, and a lot of because they are consistent, they're always seen, they're posting every day, and there's this level of people develop what's called, you know, parasocial relationships with them, where they feel like they know these influencers, and these influencers can you know, influence. And so even if are we thinking about local champions, I do think it's important to really think about them and even how to influencer training around some of these topics that we want folks to you know about and engage in. So those are my thoughts. I hope that all made sense. It's kind of
Yes,
rambly.
absolutely. And when you talk about social influencers, we was just thinking as well. I know for the radio station, a lot of people know Shack and the Pack, and like, just also informing some of those influencers like what we do, like giving them education. So when we're promoting the message and we're actually doing business with them, that we're speaking the same language and they sharing their facts and actual, evidence information and stats that they can pass along because their followers is huge, so that's important. Anyone else like to share?
I do see a
Yes.
comment here in the chat.
Okay.
We had one
Yes.
from Crystal coming from WellPoint. She mentioned that WellPoint relies on all community-based organizations within the county. So, looking at those folks as, being the organizations that they can refer to if find help, but then also use those community-based organizations to help get their message out and get their services out.
Okay, I can go next. Hello, I'm Denise Robinson again, Executive Assistant here at Community Engagement and Consultation Group. We here do a lot of outreach as well at the libraries, the schools, and then when the schools begin to open, we have the back to school events. We did the National Night Out as well. So we did about 27 so far outreach here in the county between Prince George's and Montgomery County for the month of August so far. We do have a few of them that's coming up before the end of this month. We also have I want to make sure I say this right. Two of our employees that goes out to the jail, the Seven Locks Montgomery County Jail. So we have a partnership with them to for the individuals that's coming out incarceration for to apply for SNAP and Medicaid. Um, I know we had a meeting with a radio station in Rockville because before I got here, they had donated detergent for us to give to the our clients at no cost. Um, we have partnership where we have a kidney coach, and I will become a kidney coach as well, where we do outreach to share the importance of taking care of your kidney and what can you do to prevent kidney disease. I'm trying to remember everything that we do. We do so much here at CCG. And along with that, we have relationship with food banks to refer the clients to get food as needed. The mobile medical clinic, also Rainbow is also relationship with them, partner with them to have individuals to get food. Because with that, we have 9 different languages here that our employees can help the individuals, from for their country. Um, I know I'm probably missing something, but that's basically I'm hearing about the community we serve. I know we have Hispanic program coming up, an outreach coming up, and they will be getting the, have 2 of our employees to call the barbershops to participate to be one of the vendors. So we have a relationship with them in the future, along with social media or WhatsApp as well with the different languages as well. Thank you.
There's another statement in the chat from Tanya Mahan. She mentioned, if I'm understanding the question correctly, for our patients, we use a lot of state-based resources such as Find Help, Maryland 211, Department of Health, Mental and Behavior Health Centers. Some of the resources are shared with multiple counties, tri-county, so it helps out with the continuity of care if the patient may see one of our providers in our county but live in another county, which we do see often. So good point. And then Lisa, she mentioned when I think about trusted networks and local champions, I think about faith-based organizations, schools like the PTA, nonprofits, libraries, and places that were built for the community by the community that are able to provide, to identify needs and fill in the gaps.
And that
And
kind
I
of makes
see,
me think of community health workers, right? I'm sorry to jump in,
yes.
Tonisha, but when
Nope,
I hear
go right
trusted
ahead.
networks and local champions, I always go straight to CHWs, right? Because they become trusted networks and local champions because they're drawing on their own lived experiences and their own understanding of that community's culture, their language, their social needs. And I think that because they're in that unique position, it better allows them to connect with people in the community on a peer-to-peer basis versus like professional to peer. And they can help kind of better bridge those gaps with formal health systems, help people better understand some of that medical terminology, the processes for filling out documentation or getting connected to service, and then can also encourage the community themselves to better advocate for more positive change. So it kind of answers both of those questions, but I always immediately think of our CHWs.
Yes, and I think we do have several CHWs on the call that was part of the CHIS project. So I know they worked in different communities as well. So we'd like to hear from one of the CHWs. So anyone would like to volunteer to share their experience and to talk about the trusted communities?
Yeah, I was hoping we could hear from someone from CHIS, since I know, the grant, that's our big at the health department, and a few of the community-based organizations we contract with. That's our big CHW grant that's ending unfortunately tomorrow. But I know we learned a lot in this topic related to the work that we've done over the past 4 years. So I don't know if I don't want to call on anyone, but I don't know if oh, it looks like Liz left, but maybe Shirley or Shatan or Tatua, if anyone wants to weigh in.
Hi, sorry, I am multitasking.
No,
Repeat your question.
no worries. It is so basically the conversation has been about like who are the trusted networks and local champions in the community, and then how do these networks emerge? In what ways do they serve as trusted spaces or leaders for the people they reach? So we're trying to understand like how those networks are built. So I feel like CHIS is the perfect example of really building that network over a long time. Sorry to put you on the spot.
No, you're fine. I apologize. I'm actually I was on another call and then doing some other things, but yeah, certainly happy to jump in and talk about all of the wonderful work that CHIS has done. We've built I would like to say pretty strong networks throughout Prince George's County. The program we've worked with 8CDI, TLC, CASA, certainly. IPHI is on. I see Tatua. We just got off of a call earlier this morning. But our community health workers were all over. I think I may have heard that community outreach may be on the line as well. So we worked with them and University of Maryland, Capital Region Health. We've worked in the provider offices with the practices. We've worked with nonprofits. We've worked with fire EMS. I mean, it goes on. We really tried to leave no stone unturned when we talked about networks. We really wanted to be where people had great need, and people have great need throughout the county in various different ways. And so we looked at how we could target different populations of people. And of course, we know that people go, where they're comfortable and what community that is. And so just trying to target those communities. And so we even had community health workers that spoke different languages, so that we could get into some of those communities as well and be the trusted friend, the trusted advisor, to that community to assist them with the needs that they had.
Thanks,
Thank you for
Shirley.
sharing.
You're welcome.
Yes. So there's so many more questions that we have, and I didn't realize that we only have 10 minutes left in this meeting. So I want to definitely leave time for the community announcements, but just once we will continue this conversation because Dr. Carter, he's always looking for resources and focusing on care coordination and making sure that the residents get connected with the services that they need. And so these conversations, these questions that's being answered will help, like, develop a grant proposal. We're looking at different grant proposals to help sustain and to build the infrastructure for CCT and to make sure the residents are getting connected to the resources and to make sure that we actually doing population health and everyone is working together to serve their community and to provide that care coordination. So more to this. So it's just not having discussions. There's nothing's going to happen. There will be some outcomes and actually a deliverable. So more to come as we continue these discussion. So I'll turn it over to Teller or Shanae, and for Teller to just also give like a high summary. And then Shanae, I think, or either Teller to do the community announcements. So again, we really do value your input because we do listen to what you have to say and take this resource and these information back to bring something tangible to the to CCC work group. I'll turn it over to Shanae Teller.
Taylor, did you have any last minute words? If not, I can jump into community announcements.
I just wanted to thank everyone for starting the conversation today. We have so much more to dive into. I know we've got some hospital partners on the line who we didn't get to hear from today. So would love to, chat with you all about, again, how are we really integrating our programs, working with communities and making sure that we are identifying those thought partners and those thought leaders from the start. But as Tornisha mentioned, this is really the groundwork. A lot of this population health model is going to be based on the lived experience of all of our care coordinators who are in the room. And so that's why we wanted to open up the discussion today to talk about, what are you all already doing to center community? How are you working alongside community? How can we use those best practices to uplift a new population health model and then also learn from our gaps? So thank you all for your time today, and I look forward to continuing this discussion with the CCCT.
Great. Thank you, Taylor. All right, well, I'm going to go ahead and jump right into some community announcements. It is a very busy season, so just bear with me as I roll through some of these for you. But we are excited to share information about the upcoming Medicare open enrollment event hosted by Prince George's County State Health Insurance Program. This event is a valuable opportunity, I think, for people to learn more about Medicare benefits, how to complete a benefits checkup. They'll be able to get one-on-one assistance if needed and find some ways to save on healthcare costs. So this event will take place on October 10th from 10 to 3, and it will be at the Health and Human Services building. As a coalition, we want to encourage our families to attend the Prince George's County Health Department Back to School vaccine clinics. They started in early August and will continue through the end of September. There are a variety of appointments, clinics at multiple locations offering both weekend and weekday availabilities. So the flyer is on the screen, but I will make sure to share that with you all in the follow-up email. Prince George's County Extension Open House. They'll be hosting their open house on September 4th for residents to learn about free community programs, and there's some free goodies as well. So who doesn't like free stuff? So please encourage your residents to attend, and the flyer and registration link will be provided. Prince George's County is also having their 2025 Family Caregivers Conference on Thursday, September 25th at 10 a.m. The registration link and flyer are on the slide, but I will again be sure to share that with you all after. This event will take place at Martin's Crosswinds in Greenbelt. It's open for those who care for older adults or for individuals who may have Alzheimer's or related dementia. But please note that registration is required because there is limited seating. So if you are interested or know someone who might be interested in attending, please feel free to share this information with them. International Overdose Awareness Day is coming up on Saturday, August 31st. I still can't believe we're at the end of August. Like, it's crazy. But some of our partners will be at the Laurel Multi-Service Center for a training session on how to use naloxone to potentially save someone from an opioid overdose. So this is an in-person event, and it will provide you all with some knowledge and skills needed to act quickly in the event of an emergency. So participants who attend and complete the training will receive naloxone. So again, please share this event and register to attend so you don't miss this opportunity to make a difference in your community. Prince George's County is also having their 988 Day. So they will be offering a free Safe Talk suicide alertness training. So this is for county leaders, first responders, other community leaders. So please feel free to join us. This training will take place on September 8th from 8 to 12 p.m. at the Laurel Beltsville Senior Activity Center. So please be sure to register if you are interested in attending. The second annual Health and Wellness Expo will take place on September 20th at 11 a.m. at Trinidad Baptist Church. There will be free wellness checkups, I think free dental screenings, some fitness demonstrations, and a whole bunch more. So if you are interested in attending, this is a free event that is open to the public. So again, feel free to share this flyer. The registration link is available, and you can share this with your colleagues and communities served. Suburban Hospital's Community Health and Wellness Division has shared with us their Southern Maryland Older Adults Resource Newsletter. So this newsletter highlights free safety and wellness resources and events for older adults. So I will be sure to include the attachment of that newsletter in the follow-up email to you all as well. But right now I want to open the floor for any additional community announcements if anybody has anything they want to share.
Hi, all. I just wanted to say that I my practice therapist, but specializing in grief and loss. And also, I have another therapist, Dr. Stamp, who is specializing in LGBTQ support and therapy, along with substance use issues. So they are open for referrals. If you all have anybody in your community, in your family, or in your life, or yourself that may need support, and also for clients who have Medicaid, I'm partnering with a outpatient mental health clinic to be able to provide the grief and loss support to their constituents if they cannot afford private pay services. So please feel free to reach out to me if that's of interest to anyone. I'll put my info in the chat.
Thank you. Any other announcements?
Yes, hi. We have Healthy Kidneys information. One of our employees is a kidney coach. And this Saturday and then every other Saturday at Aspen Hill Library in the morning. I don't have the time on this flyer. We'll be having to educate people about their kidneys and how important it is to take care. I mentioned that earlier about their kidneys for those, especially diabetic and high blood pressure, how it can affect their kidneys. I'll make sure I get that information out. Also, we have training classes that has started for resume writing, smart money, Microsoft Office Specialist, Excel, CompTIA A+, and basic English conversation, also a Microsoft Office Specialist in Spanish.
Awesome, thank you. If there are any other community announcements, feel free to send me an email and I'll be sure to include that in my follow-up email. But if nothing else, I do want to remind you all that our full PGHAC quarterly meeting is coming up. That will be September 9th. It's a Tuesday at 6 p.m. and this quarter will be virtual. So please feel free to scan this QR code. I'll make sure that the link is available as well so you can register. And once you register, I'll be sure to send the meeting link out. Other than that, our next CCCT monthly meeting will be Thursday, September 25th, and I'm sure we will be continuing this conversation at large and get some more insight and better understand how we can define community moving forward. So I look forward to seeing you all at both meetings. And if nothing else, Tarnisha, do you want to close us out?
Again, thanks everyone for joining our meeting today. I think this was a rich discussion. I'm looking forward to continuing the discussion and looking forward to seeing you all at our next meeting on Thursday, September the 25th. Everyone have a blessed day and enjoy your weekend.
You do the same. Thank you, guys.
Thanks,
Thank you.
everybody.
Thank you.
Bye.
Thank you so much. Bye-bye.